Hi, my name is Luciano Costa. I'm a professor of medicine at the University of Alabama at Birmingham, O'Neal Comprehensive Cancer Center. And I want to discuss one of the posters we presented this year at ASCO. There was a combination between Cilta-cel and conventional treatment for patients with relapsed refractory multiple myeloma. As we know, Cilta-cel is a BCMA binding CAR T cell therapy that is being developed for the treatment of relapsed refractory multiple myeloma. And at this meeting, my colleague, Dr. Osmani, presented an updated from that study showing 96% response rate in most patients being without progression after 18 months of follow-up. Really exciting results. However, that study was a single-arm study and becomes important to create a reference and to see how that treatment compares with other treatments those patients would be receiving. So what we did, we leveraged the MAMMOTH database. MAMMOTH is a study that we had a chance to lead a few years ago that collected across 14 medical centers in the United States the outcomes of patients who become refractory to a CD38 monoclonal antibody, like isatuximab or daratumumab. So we're able to identify on that data set patients that would look similar in terms of their disease characteristics and their prior treatments to patients that are on the CARTITUDE study with Cilta-cel. We did what's called propensity score matching. And using that methodology, we're able to recreate a quasi-control cohort that look very similar to the Cilta-cel population. And what we saw was the likelihood of response was much greater with Cilta-cel than with conventional care, 96% versus 30%. The progression-free survival was greatly superior. The 12-month progression-free survival was 79% with Cilta-cel versus 15% with conventional care. And the 12-month overall survival was 88% versus 35%. One of the frequent criticisms of CAR T cell trials is the only report on the outcomes of patients who go on to receive the CAR T. And the patients who screen for the trial, collect the cells, but whose condition deteriorates and don't make to receiving the cells are often not accounted for. To try to overcome this problem, we also analyze by intention to treat. So essentially, the bigger pool of patients who collect cells on CARTITUDE-1 versus patients on MAMMOTH. And even then, the results greatly favor Cilta-cel. Overall response rate was 84% versus 28%. And 12-month progression-free survival, 73% versus 12%. Of course, this is not a replacement for a true randomized trial and has all the caveats of when you compare real-world data with clinical trial results. However, in absence of that better quality of evidence, this provides some very compelling indication that Cilta-cel greatly alters the natural history of the disease and provide those patients a much greater chance of response and a much longer disease control that would be possible with therapies available at the time.